Common in our rural population. So you do not need such longer times to increase your risk. So if someone has done the chewable tobacco for at least 4 to 5 years, then their oral or the mouth cancer risk has definitely gone up to the tune of 10 times than the regular population. So if someone has smoked cigarettes for at least 10 to 15 years, meaning 10 or 15 pack years, the risk of their lung cancer is now at 20 times higher than the regular population. Let me also tell you that this particular term called passive smoking is also very important. Let's say we have someone in our house who is addicted to smoking. Let's say someone has smoked for more than 5 years, he is already addicted. So we have someone in our home who has smoked for more than 5 years and he is doing that inside the house. Then the one who is also not smoking is at increased risk. The one who has smoked 10 cigarettes, he has done that in the same room, and you're also getting that particular risk by 2 times. So the one who has not smoked has already smoked 2 cigarettes. If he is living with the same person who is smoking at least 10 cigarettes. So that is something called passive smoking. Passive smoking is also a risk factor to cancer. So all the more important that someone who is smoking in our home, the one who is not smoking is also at high risk. So let's say getting addicted to tobacco or smoking is very easy. But what happens if someone wants to quit it? Quitting tobacco is definitely difficult, but after understanding what happens if we start quitting, people will definitely be more interested. So in the first 20 minutes after quitting, the heart rate and the blood pressure definitely drop down to normal levels. In the initial 12 hours of quitting, the level of the carbon monoxide, which is the addictive thing which is getting accumulated, drops down to normal level. So in the initial half day, all these things are happening. In the initial two weeks, the blood circulation or your increased BP levels or your lung functions definitely are getting better. By the time you have quit for about 9 weeks, the smoker has already decreased his routine smoking related coughs and also the other allergic related tendencies. By 1 year, the risk of getting his heart related problems have almost halved like your non-smoker. By 5 years, the risk of getting mouth cancers, throat and esophagus cancers, which we just spoken, are almost reduced by half. By 10 years, they are almost as good as the normal person. So quitting smoking is what we need to motivate all our friends or spouses or whoever is addicted to smoking, because the additive or the additive effects of the ill effects of smoking definitely can come down in a 15-year time. So definitely alcohol. So anything in excess is definitely problematic. Same applies to alcohol. Red wine or your whiskey and other spirits in mild quantity. So meaning social drinking is definitely acceptable, but social drinking can never stop at social drinking. It starts as social drinking and then it becomes addictive. So definitely no to alcohol. So coming to vaccines, vaccines are the ones which are applicable to viral related cancer. So we have few cancers, the causative organisms of which is definitely a virus. So the most recent thing which we are all vocal about is the cervical cancer. So I'll talk a little in depth about that particular thing. So we have a virus called human papilloma virus, which can cause all these different cancers in different percentages. The most common cancer which we generally see on a routine basis is female lower genital tract cervical cancer. So 91% of those cancers are virus related. That's how the vaccine is helping in preventing that. There are a few other cancers, the numbers of which are shown here. About 70% of vulval cancer and the vaginal cancers is because of this virus. And also in men, the mouth related cancer, the oropharyngeal HPV related is close to 72%. The male anal cancer is about 91% is due to the virus, and penile cancer is about 63% is because of this virus. All these cancers which are HPV related can be prevented by a simple vaccine. So we are just vocal about the cervical cancer, but the prevention applies to all other cancers also as part of that vaccine which we are just talking about in terms of cervical cancer. So HPV is a common virus that affects teen and adults. So 80% of people will get a HPV infection in their lifetime, but not everybody will be at increased risk of this cancer. So, a little in detail about age for taking the HPV vaccine, at least in India. So, the right age to begin discussion about this vaccine is from 9. So, the best age is between 9 to 14, and then from 15 to 26. So, 9 to 26 is the right age to get our children vaccinated, especially the females. It also can apply to the males if they are at increased risk for the HPV related things. So if you are between 9 to 14, you would only require 2 doses. If you are between 15 to 26, you would require 3 doses as part of the cervical cancer vaccine related schedules. From 27 to between 27 to 45, earlier guidelines they were saying it is not routinely recommended, but of late in the last 3 years the guidelines have changed. So one who is between 27 to 45 can also get vaccinated if they want to. So what are the vaccines which are available? Cervarix and Gardasil. Gardasil is one vaccine which can target more number of HPV strains, so that is the vaccine which we all want to take rather than Cervarix. So, what is screening? Screening is nothing but a test which is available, which is done either to prevent a cancer or to detect it early, if there was one. So only few cancers can be amenable for screening. I will talk in detail about what all those cancers are. So with this technique, definitely we could detect and diagnose them early. Definitely we all know that the detection, if it happens in early stages, the cure rates are very high, and this applies to majority cancers, not just one cancer. And then we all know that if you are detected late, the survivals drop down, and also the cost of treatment will be very high. So let's talk a little about breast cancer. Everybody should be aware that the numbers of breast cancers are on the rise. 2015, the numbers were anywhere between 1 in 25. So in 25 females, only 1 was getting breast cancer if we were in 2015. Right now, the numbers are anywhere between 1 in 8 to 10. So every 8th, 9th or 10th female is having breast cancer, at least in India. In the Western population, the numbers are even higher, but at least in India, every 8 to 10 females, there is 1 female who is diagnosed with breast cancer. So, and breast cancer is also the most common cancer diagnosed across the world. Even in India, the most common cancer is definitely breast cancer. And if we had one screening tool to detect a cancer, definitely breast cancer stands alone in that particular screening test, because there are simple tests with which we can detect breast cancer early and then increase our cure rates. So, what are the risk factors? Definitely gender, majority are females. It is not that males do not get it, but the chance is just only 1%. So majority, 99% are definitely females. Age, the more you age, the more your chance of breast cancer. Alcohol, and if you are exposed to radiation in your childhood, let's say you are exposed, let's say you have been treated by a radiation technique for a different cancer in your childhood, that will increase your risk for breast cancer in your once you reach 50s or more than that. Genetic tendency is one thing which is very much related to breast cancer. I will talk a little in detail about that. Hormonal imbalance also increases your risk factor for breast cancer. Abdominal obesity increases your risk for your breast cancer. So what are the screening options available? So every female should be aware of something called self-breast examination. Self-breast examination is nothing but you yourself examining your breast while lying in front of a mirror. So you would just palpate your breast in a circular direction. So there are enough videos which are available online to understand how to do this self-breast examination. So every female should start doing this by the time they reach 20. So the frequency of when you do it can vary. You could do it once in 2 weeks, once in a month. That could vary, but then you should be aware that you should keep doing it from the age of 20. What to see while you do self-breast examinations is very important. So any lump or a swelling inside your breast is what you should be. You should try and notice while you do your self-breast examinations. Any change in the skin color of your breast is what you should notice. Nipple is generally outwards, but if the nipple is going inward is what you should be worried about. If there is a discharge from the nipple, the only thing which should come out of your nipple is milk while you are breastfeeding. Apart from that, anything which is coming out, let it be a serous discharge, a whitish discharge, blood or pus, it is telling us that something is going wrong inside the breast. So all these four things, any lump, change in skin color, nipple going inward, or any discharge from your nipple. These are the four things which you try and see while you do your self-breast examination. This should start as early as you are 20. So by the time you are reaching 40s, you already are well versed or well experienced of doing these examinations. The chance of picking up a lump when it is of the mildest size will increase. So a lump which is crossing 1 centimeter will make it detectable with hand, but only if you keep doing it on a regular basis, the chance of picking up it will increase. So let's say you are 40, 45, you have started your self-breast examinations. No, it is very difficult to pick up a lump when it is very small. So if post 2 or 3 centimeters is definitely evident, but we want to pick it up early. So self-breast examination should start as early as 20. Then the same thing if it is done by a doctor, let's say an oncologist or a gynecologist or any physician, any doctor, if they are doing it, that's called a clinical breast examination. So we do that post 40. Till 40 self-breast examinations are good enough. Post 40, every female as a universal breast cancer screening guideline should undergo an yearly mammogram. So earlier in 2015 and prior to 2020 also the number when you are getting eligible to do a mammogram was different across different societies in the world. But now come 2022, all the guidelines across the world have universalized this particular age of doing mammogram to 40. So once a female crosses 40, yearly mammogram is mandatory as part of the breast cancer screening guideline. So yearly mammogram plus clinical breast examination by a doctor post 40, and also self-breast examinations to continue. So ultrasound is one thing which we would do sometimes as an adjunct to mammogram. Let's say if you have a high risk family history and we want to screen them more often than the general population, so what we spoke is for the general population. So if you have 2 or more breast cancers running in your family, you would become high risk. Then we would offer these particular examinations at an early age rather than 40. So at early ages we don't do mammograms because the young females, the breast is dense. To study that, we would require either an ultrasound or MRI. So sometimes we would use ultrasound and MRI, but majority of the times it is mammogram and breast and self-breast examinations and clinical breast examinations. So all women should have a risk assessment at least by 30, annual mammography after 40, and screening should continue till 75 and more than that. So what happened after we we started inculcating all these breast cancer screening guidelines into the general population. It is not yet included in our Indian guidelines, mind you, but then these are being followed very rampantly in the West. So what happened in the West is the chance of picking up a breast cancer as early as stage 1 and 2 had increased by 50 times after you had included the breast cancer screening mammograms into the general population as a guideline. It is not yet being done in India, but sooner or later this will be done because government is slowly going in that direction. They have started that with cervical cancer vaccine. Come 2029, we will have this breast cancer screening guideline to be followed across the general population, coming from the government as a guideline. So till that happens, we know that we should be at least aware that these guidelines are there, and we should follow them to increase our chance to pick up a breast cancer early. The point is, 25% reduction had happened in terms of advanced stages reduction when compared to the unscreened women, independent of the treatment which is being given later. So then again, we are all sometimes we are worried about increased risk of this mammograms radiation. Let me tell you, the radiation which a screening mammogram is giving you is a dose of 3 microgray for each mammogram. So we are advising only yearly mammogram. Let me tell you, that is equivalent to a 6 weeks of natural background radiation which is there in the environment. So you should not worry about increased risk of radiation in terms of the screening mammograms. So definitely the best protection against breast cancer is early detection. Also, to put forward a little numbers, stage 1, 2, 3, 4, the 4 stages of every cancer, and even it's the same with breast cancer, are numbers. The majority are still being picked up in stage 3. 60% are being picked up in stage 3. Only 15% are being picked up in stage 1 and 2, even on today's date in India. Let me compare that with the Western numbers. 60% of their cancers are being picked up in stage 1 and 2. We are at 15%. That is because they are following the breast cancer screening guideline. They are more aware. The government is pushing the screening mammograms very rampantly into the population. Once we do that, even the stage reversal will happen even in India. So, stage 1, 98% cure rates with breast cancer. Stage 2, 92% cure rates in breast cancer. So, although the breast cancer is increasing and it is the most common cancer, it is also the cancer with the highest cure rates. So, you need to be aware of that. So, that's why the more effort we need to put on to pick up these cancers early, because like I said, 1 in 8 to 10 will get this breast cancer eventually in their lifetime. Coming to cervical cancer, so what are the risk factors? I said virus is the most common causative organism for this cervical cancer. Close to 90% is because of that. Then many partners, if you have that history, if you are given birth to many children at a young age, or if you were smoking, that increases your risk for cervical cancer. So we just spoke about the vaccine. What are the other tests available to detect this cervical cancer early? I think we all know about Pap smear. So that is one test which could be done every 3 yearly, starting from the age of 21. So between 21 and 50, you could only do that Pap smear every 3 years. That would suffice to pick up a cervical cancer early. Between 30 to 45, you will continue to do 3 yearly Pap smears, and also there is one more blood test called HPV test, which could be done every 5 years to detect this early. So post 65, the incidence of cervical cancer generally decreases, so you need not follow the screening guidelines once you cross 65. So let's say someone had already undergone the vaccine, whether they should still continue to be screened. Yes, they should still continue to be screened. And then coming to the oral cancers, we just spoke that the chewable tobacco is the one risk factor which will increase your risk for developing these particular oral cancer. When I say oral cancer, it could be related to the tongue or your cheek or something inside going till throat. So all these put together will be classified as oral cancers. So these are more rampant in our rural populations because the incidence of the chewable tobacco, the usage of chewable tobacco is very high among our rural populations. So tobacco and alcohol put together are more additive than done on an individual basis. So what could be done for them is only the ones who are at high risk. Let's say someone has a habit of chewable tobacco for more than 5 years, then something called the 8-step oral cancer screening could be offered to them. This is nothing but a detailed examination of the oral or the mouth cavity, which we could do on an OPD basis with specifically examining few areas and then doing biopsies if required. If we see a non-healing ulcer or if we see an area which is suspicious. So this could be offered only to the ones who had done the chewable tobacco for increased period of time, not to the general population. So let's come to one more cancer which is dreaded, that is lung cancer. So there is no one test which could be offered to the general population as a screening routine, but there's something called a high-risk population. So if you are currently smoking or if you had smoked for more than 15 to 20 years in the past, that would be classified as a patient who has a high risk for lung cancer. Something called a low dose CT scan of the lung could be offered only to this particular population, not as a general rule to the population. But then, yes, someone who has smoked for more than 20 or 15 or 20 years, this particular low dose CT scan could be offered. So, then again, coming to the GI related cancer, that is your stomach or your large intestine or the small intestine cancers. So even with this cancer, there is no screening tool offered as a guideline, at least in India, but in the Western population, post between 45 to 75 years of age, you could specially come and speak to your doctor, and then on a patient-to-patient basis, we could offer something called colonoscopies or the upper GI endoscopies, where you examine the entire length of your large intestine and also the food pipe and also the stomach with a specialized camera, which is generally done by gastroenterologists on a 5-yearly basis. So even this is not for the general population, only on a case-to-case basis, or someone who has a family history of a colon cancer or a gastric cancer, we could specially offer these particular tests at least to that particular family, or someone who wants to do it on their own. So 5-yearly scopies is what we generally require to do as a screening test to detect these large intestine or the gastric cancers early. Then, so we know that females, breast cancer is the most common cancer. Then coming to males, something called prostate cancer is the most common cancer which we see on a routine basis. The numbers as of 2023, 1 in 7 males will get prostate cancer eventually in their lifetime. This is one cancer where there is no increased risk factor. The only risk factor is age. The more you age, the more your chance of getting prostate cancer. So the symptoms can be very vague, generally getting up more frequently at night, or the urine stream, if it is becoming difficult, you are putting more pressure to release urine, or you are passing urine more often than not, then all these symptoms are labeled as lower urinary tract symptoms, LUTS. So it could be a plain and simple enlargement of your prostate gland most of the times, but sometimes that particular enlargement or the prostate issue could be a prostate cancer also. The symptoms can be very vague. So if you are more than 60 or 65 and you are experiencing one such symptoms, then better you get yourself checked for prostate issues. So how to screen or offer a simple test for detecting this particular prostate cancer is nothing but doing a plain and simple blood test called prostate specific antigen. It is called serum PSA, which is generally there in all your routine health checkups also. So you could offer this particular test for all your males who are crossing at least 55 and 60 till their lifetime. So that is one thing, and also adding digital rectal examination. This is generally done by your doctors, whoever you are seeing you. It could be a physician, it could be an oncologist, it could be a urologist, whoever is doing that. Something called a digital rectal examination could be done, and checking the size of your prostate. Generally we club all these tests with some ultrasounds which will tell us what is the size of our prostate. So prostate cancer post 55, you could offer them serum PSAs yearly. So in a nutshell, 25 to 39 cervical cancer screening is important, 40 to 49 cervical, breast, colorectal on a case-to-case basis, prostate not this early, but if you have a family history of a prostate cancer patient below 60, then you should start offering screening to the other population 10 years earlier. Okay. So post 50, we just discussed what all are important in terms of screening. So